Welcome to Medicine Information Factory YouTube channel. Today we shall discuss about Flurbiprofen. What is Flurbiprofen? Flurbiprofen is a non-steroidal anti-inflammatory drug used to reduce pain, inflammation and fever. How does Flurbiprofen work? Flurbiprofen blocks enzyme called COX-1 and COX-2. These enzymes help produce prostaglandins, chemicals that contribute to pain, swelling, and inflammation. By reducing prostaglandin production, Flurbiprofen relieves pain, reduces inflammation and swelling, helps lower fever. Common uses: Flurbiprofen may be used for arthritis, including osteoarthritis and rheumatoid arthritis, muscles and joint pain, back pain, dental pain, other inflammatory painful conditions, in some formulation, eye inflammation, pain after eye surgery, sore throat, in certain lozenges formation. Common side effects: nausea or vomiting, indigestion, heartburn, stomach pain, diarrhea, headache, dizziness. Important risk: like other NSAIDs, Flurbiprofen can sometimes cause stomach ulcers or gastrointestinal bleeding, kidney problems, fluid retention, and an increased risk of cardiovascular events such as heart attack or stroke, especially with higher doses or prolonged use. It should generally not be combined with other NSAIDs such as ibuprofen, diclofenac, or naproxen unless specially advised by a healthcare professional. Uses in pregnancy and lactation. Flurbiprofen in pregnancy. Flurbiprofen is an NSAID and its safety depends strongly on the stage of pregnancy. First and second trimester, it should only be used if clearly necessary and prescribed by a healthcare professional. NSAIDs are generally avoided when safer alternatives are available. From 20 weeks onward, NSAIDs can potentially cause fetal kidney problems and reduce amniotic fluid, particularly with prolonged use. Third trimester, Flurbiprofen is generally contraindicated, should be avoided because it can cause premature closure of the fetal ductus arteriosus, fetal kidney problems, and complication with labor and bleeding. Bottom line, Flurbiprofen should not be self-used during pregnancy. Paracetamol is generally preferred for pain or fever when appropriate. Flurbiprofen during lactation. Flurbiprofen passes into breast milk in very small amounts. Available evidence suggests that short-term maternal use is unlikely to cause problem in a breastfed infant. However, use the lowest effective dose for the shortest duration. Monitor the baby for unusual sleepiness, vomiting, diarrhea or poor feeding. For repeated or high dose in treatment, discuss alternatives with a healthcare professional. Overall, Flurbiprofen is generally not preferred during pregnancy, especially after 20 weeks and in the third trimester, while short-term use during breastfeeding is generally considered low risk. Overdose. Flurbiprofen overdose. A Flurbiprofen overdose can cause excessive NSAID toxicity, particularly affecting the stomach, kidneys, nervous system, and cardiovascular system. Possible symptoms include nausea, vomiting, stomach pain or indigestion, drowsiness, dizziness or headache, ringing in the ears, gastrointestinal bleeding, confusion or loss of consciousness in severe cases, reduced urine output or acute kidney injury, difficulty breathing, seizures in severe poisoning. What to do? If someone has taken more Flurbiprofen than prescribed, seek urgent medical assessment. Even if they initially feel well, severe toxicity can develop without obvious early symptoms. Do not induce vomiting unless specially instructed by a medical professional. Do not take additional NSAIDs such as ibuprofen, diclofenac, or naproxen. Take the medical package container with you so clinician know the strength and formulation. Treatment in hospital is mainly supportive with monitoring of kidney function, electrolytes, vital signs, and gastrointestinal or neurological complications. There is no specific antidote for Flurbuprofen overdose.